Welcome back to AM Northwest. If you've struggled with being overweight and you've tried every non-surgical weight loss option with no success, Janice Banks may have a solution that's right for you.
Hi, I'm at Oregon Weight Loss Surgery, and I am with Dr. Emma Patterson this morning. Good morning, Dr. Patterson.
Good morning.
So what is it that you do for patients here at Oregon Weight Loss Surgery?
Well, we help patients change their lives through weight loss surgery.
And what kind of surgical options do you have available for people?
There are really three options now, and I do all of them laparoscopically with the small incisions. There's a gastric bypass, the sleeve gastrectomy, and the lap band.
And what's entailed with the bypass?
So with a bypass, it involves the stomach and the intestines, and I take the stomach that's about this big and cut off, really make a new stomach out of the top part that's about like a golf ball, and then bring the intestines up to that stomach, so the food then will go into the little teeny stomach and straight into the intestine and bypass most of the stomach. And so then patients can only eat a little bit of food, and it makes them less hungry too.
Oh, nice. And what about the sleeve?
With the sleeve, I remove about 80% of the side of the stomach and make it into a long, narrow tube, just like the esophagus. And so, again, patients can just eat a little bit of food, and it fills them up, and they're not very hungry in between meals.
And we've heard about the lap band. Can you describe the lap band procedure for me?
Yeah, so the band, I should have one here on a model, but the band is an implantable device. It's shown right here. So it's a silicone ring or belt that goes very high up on the stomach. And then there's this long, narrow tubing that connects to an access port shown here that will be sewn on the patient's muscle under their skin. And so this, and it's adjustable. So in the office here in follow-ups, we pass a special needle through this little septum, and it can add or remove fluid. And that helps control how much a patient can eat and also their hunger. So it was designed to actually reduce the amount a patient could eat, but we have learned that it actually reduces their hunger. So they fill up on a little bit of food and they're not hungry for hours.
That sounds really nice. And what is it that what health requirements do people need to meet to qualify for one of these surgeries?
Well, in general, we follow the National Institutes of Health criteria, which are that a patient should have a body mass index or BMI over 40, and that's a measure that takes into account their height and weight, and a BMI of 40 is roughly 75 to 100 pounds overweight, and that threshold is lower to 35 or 50 to 75 pounds overweight, depending on their height, if they have what we call a comorbidity, which is a medical problem that's more common in obesity and tends to improve with weight loss, such as diabetes, high blood pressure, sleep apnea, things like that. And for the band in particular, being a device, it's controlled by the FDA. And just last year, they actually lowered the weight or BMI limit for the band to 30, which is just 30 or 50 pounds overweight, provided the patient has also a comorbidity.
Oh, interesting. So you really help people lose weight, but I'm guessing for you as a person, that is very rewarding to see these people's lives transformed.
Yes, I mean, it's very rewarding as a physician to see their medical problems improve, such as diabetes go in remission, but what's really fun is hearing the personal stories and how it's affected their life. Like, they can travel again, and they can get down on the floor and play with their kids or grandkids, or simple things like just the other day I saw a patient who was just 1 month after surgery, has already lost a bunch of weight, and for the first time in years he was able to rub his own lotion on his feet. And he was ecstatic about that. So it's the little things like that that we tend to take for granted that my patients often can't do.
Well, that is very exciting. So if you are in a place in your life where you would like to get rid of the weight once and for all and really have a transformative experience, go to OregonWeightLossSurgery.com for more information. Back to you.
All right. Thank you, Janice. We're back with more AM Northwest right after this.